Hari Raya Puasa is just around the corner, marking the end of the Muslim fasting month, and it is during this period that the Malay Muslim community reports fewer heart failures. And when the Hungry Ghost month starts on Friday, there would also be fewer heart problems among the Chinese. That's according to 2 doctors from the National University Heart Centre Singapore, who are among a team of 16 who analysed heart patient admissions in public hospitals here between 2008 and 2010. The year-long study, which is based on 8,000 heart-related admissions, with most of the patients aged between 60 and 70 years old, found a 24% weekly drop in admissions for the Malays and a dip of 9.6% for the Chinese.
When the heart doesn't work properly, it doesn't keep circulation and fluid going around the body properly, then the fluid accumulates in the lungs and you get breathless. So you can imagine if a heart failure patient suddenly takes a really big salty meal and drinks a lot of water, the heart cannot cope and they will come in with heart failure. So it is a disease that is, we know, very affected by food and diet and fluid, and very affected also by whether or not you take your medicine.
The cardiologists believe that the strict adherence to fasting and consuming medication is the cause of lower admissions among the Malay Muslim community. On the other hand, the month-long Hungry Ghost Festival is deemed an inauspicious time to fall sick, so the Chinese community tends to get more vigilant in their diet and medication.
Because many Chinese believe that if you get admitted during Ghost Month, it's an ominous, thing. You may not get out of hospital alive. So maybe Chinese patients are taking preventive behavior to deliberately, keep their heart failure condition in control, prevent exacerbation. So during that period, maybe they are taking their medications more regularly.
That's what we think.
They may be deliberately avoiding salt and fluid intake, one of the known precipitants of heart failure decompensation.
The study also found the number of Chinese admitted during Ramadan remained the same, and the number of Malays admitted remained the same during the Hungry Ghost month. The number of Indians admitted during these months remained the same. The doctors also found that the decrease among the Chinese was not due to them holding out for a month and visiting the hospital only after Hungry Ghost Festival was over.
In fact, we didn't find a rebound phenomenon at all. So we feel that whatever that these patients are doing maybe is actually keeping them in good shape. They are not just holding back at home, waiting for this month to be over and then come in the next few days.
Last year, when the Hungry Ghost month and Ramadan coincided, both Dr. Loh and Dr. Lam noticed a significant drop in heart failure admissions, which led to the study. Now that the findings have been submitted to 2 medical journals, the 2 cardiologists now hope to pinpoint what exactly could have resulted in patients becoming healthier during these 2 cultural months. Even considering bringing on a psychologist for the next study, they feel it could be the power of the mind at work.
If you want to be healthy, I think it translates into behavioral though. It's not just a one and then you don't change anything, I just think that somehow if we want to be healthy, we will naturally pay more attention to our bodily needs and be a bit more obedient with the medications and so on.
The link between Ramadan fasting and a healthier heart is clear, but what about the Chinese community? Is it mere positive thinking at work during Hungry Ghost month?
You think you are well, but you're not really well. So by the time the people who are admitted are really sick, but we looked at that.
Yes.
So we compared the characteristics, the clinical indicators of severity of disease among the Chinese admitted during Ghost Month and non-Ghost Month. Paradoxically, the indications are they're either as sick or not as sick. And length of stay is if you're more sick when you come in, you definitely need longer, right? The length of stay was paradoxically shorter among Chinese admitted during Ghost Month. So, that kind of debunked that you think you're well, you're actually not, then by the time you come in, you're more sick. Also, it's not. So they are truly more well.
But if the mind can indeed dictate the body, the doctors hope heart patients will take it upon themselves to prevent readmission. Nationwide, Singapore experiences 80 heart failure admissions a week, and readmission is known to be high.
In fact, we think this is going to be an excellent educational tool, to tell patients that, you can be empowered to make a behavioral change, and that can translate to decreased heart failure admission rates and better quality of life.
Empowering the patient, take charge of your own health. There are many little things that we can do.